This is QD Clinic, stills or not. Hi, I'm Dr. Jack Cush, executive editor of RheumNow.com. We're doing a series on stills or not, meaning cases from the clinic where you've got to decide, was it Still's disease or something else? This is a really old case. In fact, this was a patient of the very famous Gerald Rodnan from the University of Pittsburgh. And I was reading his notes many, many years ago and came across this letter. It's a letter from the wife of a patient who's afflicted with a febrile disorder. You've got to figure out, is it Still's or not? She says, illness, unknown crippling malady. Interesting title, huh? Symptoms, begins with intense sore throat, muscle weakness and soreness, joints red and swollen. There was an itchy rash, hearing loss, and he can't eat. He's losing weight. He's alternatively feverish and shaking with cold. Now he's practically immobile. His history first began April 23rd and went to the hospital a week later. Chances of survival looked bad. The diagnosis was rheumatic fever, but after the first week, it was decided that was the wrong diagnosis. Tests of every sort were made and all proved negative. He was sent home May 19th, though he didn't look good. His fever stayed up over 103. June was bad for him. By July, he's working full-time again. Very interesting, huh? What do we see? There's arthritis, crippling, immobile. Began with a sore throat. He's got myalgia and soreness. His joints are swollen, we said. He's got an itchy rash. He's got hearing loss. He's losing weight and has anorexia. He has fever, although they don't describe the fever pattern other than it was alternatively feverish. And then he would get the shaking chills, which usually follows high fevers. But did the fever go back to normal? We don't know. June was bad for him, but the disease remitted. And by July, he was working full-time again. So this started in April. He was in the hospital in May. June was bad. In July, he's at least back at work. Stills or not? Well, this patient was included in a series that I published back, I don't know when, maybe 2000. No, it's actually 1990 or so. The authors on it are myself and Tom Metzger and Wallace Christie. But in retrospect, maybe this man didn't have stills. Maybe this man had, and the key hook in this history is the sensory neural hearing loss. When you see that, that should be the big red flag for Muckle-Wells syndrome. Muckle-Wells syndrome was described first in 1962, and since then we've come to know this as an autosomal dominant disorder where there's a missense mutation of the NALP3 gene that leads to activation of caspase-1, meaning the inflammasome, and excessive release of IL-1, which causes all the symptoms. While most of these, again, this is an inherited disorder, it's included in the cryopyrin-associated periodic syndromes, or CAPS. Muckle-Wells is one of the three disorders in there. Also, the other ones being FCAS and NOMID or SINCA. And those are being much more rare and very different than this. Most of these cases occur before the age of 20. There's about 10 to 20% that can occur after age 20. And there's probably about maybe 20 variants on this mutation that all lead to the same kind of features. The features are, the classic triad here is the urticaria, the nerve deafness, and then, unfortunately, the late development of amyloid nephropathy. So there, again, many of the cases, the episodes are brought on by exposure to cold, and that can lead to patients feeling achy, flu-like, bad fever, Like the fevers are not as prominent here as they are in Still's disease and other febrile disorders. Maybe only 30-40% of patients have fever, and the fever lasts in general 3 to 5 days, but usually no more than 7. And that becomes important in the differential diagnosis. Other features here include conjunctivitis, fatigue, abdominal pains, and again, that amyloidosis, which occurs in about 25% of patients, can lead to renal failure. Patients with Still's disease don't get renal failure, although Still's, systemic JIA, can be associated with amyloidosis, like the other autoinflammatory syndromes. But if I see that, I'm thinking other autoinflammatory syndromes like this one, and FMF and a few others. The labs are crazy high white count, high SED rate, and whatnot. I once had a patient come in for a visit with his mother. The patient was about 35. The mother was about 70, and he came in and said, my mother and I have had fevers intermittently for a long time. We've been called Still's disease, and that's why we're here to see you, Dr. Cush. But we don't think it's Still's disease. We think we have Muckle-Wells syndrome. This is like in the first 2 minutes of the visit. And I asked like 2 more questions, and sure enough, it was Muckle-Wells syndrome, proven by gene testing and whatnot. The treatment of Muckle-Wells, very responsive to IL-1 inhibitors. And again, the key to the diagnosis here is the duration of fever. Still's disease, it's a fever every day, and it should last for 6 to 12 months, continuously, daily, spiking, and then going back to normal, hence the quotidian pattern. But when it's not daily, and it comes and goes, and is therefore periodic, the duration of fever becomes diagnostic. 1 to 2 to 3 days, that's like FMF and very few other disorders. When you start having 3 to 5 days of fever, you're thinking of this, Muckle-Wells syndrome, hyper-IgD, and FAPA, PFAPA. When you see fevers of 10 days to 3 weeks, you should be thinking TRAPS. Anyway, in this patient, letter from DM, we don't know for certain that it was Muckle-Wells, but the sensory neural hearing loss with the rest of the story makes it likely. Tune in for more, Stills or Not.